Good morning once again. And I also want to use the opportunity to thank Drugstock for inviting me to share this knowledge for people to be able to work towards integrating clinical practice into pharmaceutical care. So the topic for me is optimizing patient care, integrating clinical practice into daily pharmaceutical care. So this is my outline and overview. As a way of introduction, we all know that pharmaceutical care is something that has evolved in pharmacy practice. And this speaks a lot about going beyond the traditional role of dispensing medications to a more patient-centered approach, meaning actively involving pharmacists in direct patient care. And the integration of clinical practice into daily pharmaceutical care is found to be essential to improving patient outcomes. It has helped to minimize medication errors and ensure optimal therapeutic efficacy. As we transition from merely dispensing medications to be integral members of the healthcare team, we'll have to go a lot further and do a lot more, bring more to the table, because this would enable us to contribute to medication therapy management, patient education, personalized medicine, and pharmacovigilance. We'll talk more about it as we go along. So, meaning that clinical pharmacies now focus on patient-centered care, where we play proactive role in the sense that we don't wait until the patient really needs. We go as far as starting early, and that's where even in primary healthcare, we are parts of the clinical team that is involved in that. And you see that these days a lot of pharmacists are in the primary healthcare space, especially in the community pharmacy, because this way we're able to prevent adverse effects and collaborate with other healthcare teams. Our involvement has gone as far as chronic disease management. That's we're assisting in the management of conditions such as hypertension, diabetes, asthma, kidney diseases, especially the non-communicable disease, where we're always there to play a part that we need. And of course, what we do most times is to optimize medication use and adherence. And now we're going to be doing this. We'll talk about this. Yes, we know we do it in one way or the other, but we need to step up in doing it so that the outcome will be more than what we used to see in the past. Then antibiotics, antimicrobial stewardship. That is one aspect that pharmacists need to get involved more, because the truth is that the antimicrobial agents, with every passing to the effectivity of those agents are beginning to reduce because of resistance, because of overuse and other things. And unfortunately, development of newer molecules are not forthcoming the way it used to be. So pharmacists have a role to play in preserving the ones that we have now, so that we don't have a situation where we have all these super bugs, super infections that becomes a problem. Also in immunization services, we have a role to play in this, and I'm happy that some community pharmacists are already having a place in this. They already position themselves. So this is just going to be a wake-up call that more pharmacists, especially community pharmacists, need to go into this immunization space more, because the truth is that the immunization space can never be, you can't find a situation where the people in that space are too many or what, because pharmacists, our training is total, our training is wide, and we're able to do quite a lot of things. All we need to do is, if we can just go the extra mile to get maybe like a solar fridge, because yes, I know that I've heard some people talk about light issues and all those, but there are other alternatives and options. So I think it's something we should look at, so that the regular and the common ones that needs to be done, even the ones that are literally done in the hospitals, when we know that we can offer this service, people will always come and come out to look for us, and then that primary healthcare space will be able to take our place. And also a mental health support. A lot of pharmacists are going into this mental health support now, and it has helped a lot in the community pharmacy space, in the hospital, and some other spaces. There are a lot of trainings that are geared towards knowing how to counsel patients that have a lot of that have mental cases, especially now that we have a lot of situation of drug abuse and misuse and some other things that goes with it. So the components of integrating clinical pharmacy will include medication therapy management, also known as MTM, then patient counseling and education. Pharmacovigilance and adverse drug reaction is also a very important part of the component. And this involves the monitoring. So pharmacist has a place there when we monitor. And the good thing now is that you can even go online and write out the, fill the form online and it gets to the right place so that it serves as a signal, and as more comes in, we'll be able to make sure that this is documented properly. And that's where documentation comes in. Then there is also interprofessional collaboration. We should be big on this, actually. Pharmacists, that's one way to go. Whether we like it or not, that's one way to go. Well, to some people, they might feel it's discouraging the way some other members of the profession know. That is not today. I think, like I always tell people, it is a case of nobody wants to know what you know unless you let them know what you know. And once any part of the medical team, the profession found out that you have something to offer that makes their job easier, and at the end of the day, patients are better for it. It's a matter of time. We just have to collaborate with you. And then there is pharmacogenomics and personalized medicine. Okay. Okay, so medication therapy management now, also known as MTM, as I said, is a patient-centered process that creates treatment plans that is centered on patients' medical-related. For strategies that are used for MTM, there is continuous education and professional development. We all know about that saying that says that education and knowledge is continuous. You just keep gaining it till you go to your grave. And for pharmacists, the way pharmacy profession is designed, for you to stay on top of your game, you just need to continually get that education, that current education that would be used, that can use to trendy education that can use to make sure that you're able to get the right information. That because the truth is that the pharmacists, the patients out there now, and your clients, they, because of the internet, the social space, the IT space, where a lot of knowledge are there. So they seems to even have a lot of knowledge that they can use to come up with you. So for you to, as pharmacists, to be able to stay on top of your game, you need to update your knowledge. Very important. And this will involve keeping up with medical advancements that comes with it. And then also strengthening pharmacist patient and pharmacist physician interactions. We've talked about it and we'll still talk about it later. But that's the core of that is communication. Communication. Because you found out that some of the issues that comes up with the interactions, or should I say collaborations now, is communication. Sometimes you find some people saying that, oh, the communication, the way some pharmacists communicate their intervention, gives this impression that like doctors don't know anything. That's just an example. And the truth is that it's not only the medical doctors now that we're collaborating. We're talking about the whole medical team, even the physiotherapists, the laboratory scientists, everybody, and also even the patients. the patient and patient relatives. So the way you communicate will go a long way. There's a difference between things like between you saying something like, why would you give this kind of drug? But you should know that this dose is too small. You should know that this, or but what I know is that you can't use this or something. It's different from, can we consider this particular? Because there are some studies that says, anybody, no matter how confrontational the person feels, by the time you're bringing in this and you are bringing current and evidence-based, they would always, okay, let's listen, what does this person have to do? And once that the person looks at that intervention and sees that it works, that time, there is no way, before you know it, person is seeking you out. So that is very important between pharmacist, physician, and all other part of the medical team. So, of course, then we'll talk about establishing guidelines. I think on 2 occasions now, I've been a member of Diabetic Association of Nigeria when they were going to form a guide, we're going to come up with guidelines for management of diabetes in Nigeria. And what I found out, like, well, of course, it was just somebody that recommended. The same thing with Hypertension Society of Nigeria. Somebody recommended I should be part of it. And the funniest thing was that when I was there, some people mentioned that, what do you think a pharmacist is coming to contribute to this and everything? Like, let's see how it goes and everything. At the end of the day, they were, oh, so this aspect of pharmacy practice comes to play, and because whether we won't like it or not, and nobody has denied that pharmacy, drugs, medications is the center of any management of any patient. Yes, there are some non-pharmacological management, but quite a lot of pharmacological, a lot of disease management will come with pharmacological management. So, and why would you manage without the drug? So, I would like to be part of the clinical guidelines, but we can develop that clinical guidelines based on the way we interact with our patients, some things that were found that, so that when we are called upon, we are able, and this would involve us using electronic health records. So many institutions now have gone into using electronic health records, and that's a good one. It's a plus for us, because I mean we should really get away from the hard copies of carrying files about them. So one important document falls off and everything. And then another good thing about the using of electronic health records, if community pharmacists can develop it, so that when your patients, when your clients come around, you document some of the things that you have done with them, and it's easy to go back and look at it by the time they come around. It's continuous. Yes, I know that there are some documents, some books that has been designed to document like that. But if you can start using the electronic health records, where every dispensing, especially for some patients that, especially the non-communicable disease patients, if you document for them, like that is easier. Like even if by the time you want to like send, maybe you want to send them to the hospitals around or anything, it's easier to pull up what you have on them, and it makes it easy for them to get management if the treatment has to continue. That will go a long way. Then also participating in hospital rounds, ward rounds, especially in multidisciplinary ward rounds. This will come place for in the hospital. Okay, so because of I quickly got in a case study to whet our appetites. So there's a 60-year-old male patient with history of uncontrolled hypertension and diabetes that visited an hospital with complaints of frequent dizziness and fatigue. Yet the patient is on his medications, and the medications as the antihypertensives, multiple as usual. And then, but the two key medication here is the calcium channel blocker and a beta blocker. And of course, because the patient has diabetes as metformin. So when you look at a case like this and the patient is coming back and to say that I'm usually having this dizziness and fatigue despite using my medication, but my numbers are okay, in the sense that the numbers, that's the blood glucose numbers, the blood pressure numbers, everything is okay, but this dizziness and fatigue is an issue and everything, and you want to come in. So what I would advise is that you do a kind of MTM intervention plan for that kind of patient. And the first thing is to review the medications that the patient is using. Of course, you already identified a potential drug interaction in this patient, because the patient is on a CCB and is also on a beta blocker as much as the patient is also on metformin. And you want to find out whether the patient is on other medications. So you just do a total comprehensive medication review. And in the process, you might even find out some medications that is not even documented that you have. So after I have done this, if, for example, you have, let's say, like it is in the hospital, you can now go with the physician to issue here now is the fact that the beta blocker is found to cause dizziness, especially when it's used with CCBs. So for patients, if they're going to be used with, because maybe there's some cardiogenic effect that will make them to use beta blocker, might need to space out the medication. But if after that there's still that dizziness, that it's so much, because the dizziness sometimes can be so much that the patient is affecting the quality of life of the patient, you can change to ARB. But before changing to ARB, for example, you need to find out about the EU creatinine. That's the electrolyte creatinine of the patient. If it is normal, if it's a normal range, yes, can change to that. But even if it's slightly increased like that, you need to be careful with the ARBs, because ARBs have been found to cause AKI for some patients. We'll also talk about that one later. Then, of course, you want to counsel the patient on proper medication timing. Like I just mentioned, you can have them to space out sometimes if that would help instead of using together. Then there is also dietary modifications that we discuss, and importance of adherence, because I can assure you that with time, this kind of patient will have issues with adherence. Then also as part of monitoring, after documenting things that patients need to do that you give to them, it is for them to continue to monitor their blood pressure and blood glucose. Document it, and when next they come, for those in the community, they should bring it out. You can even design like a small notebook or a small jotter that you give to the patient to document these things, so that when they come around again, it becomes documents that can be used to monitor and follow up the patient. Okay, effective patient counseling and education are also integral parts of pharmaceutical care. And pharmacists must ensure that patients fully understand the medication regimens patients are on, the proper usage, potential side effects, and lifestyle changes that will improve therapeutic outcomes. Just always note that quality of life of the patient goes a long way. Okay, stop here now. I don't know what's. Okay. So, yeah. Okay, so the key components for that information now will be medication adherence. Keep advising the patient on the importance of medication adherence. We'll talk more about it later. Then, of course, understanding effects that are not severe, you let the patient know. The ones that are severe, as much as possible, though there are some documented severe side effects for as part of the literature for a particular drug. But the truth is that some patients still might not experience that, but you let them know about it, so that if there is anything like that, they should document it and quickly get back to you so that we can do the necessary intervention, which includes changing of medication or anything else that needs to be done to make sure that the patient safety comes is paramount and comes first. Then health literacy improvement too, simplifying the medication information to ensure comprehension, especially for elderly and low literacy patients. In my setting, we've had to look for pharmacists among us, even fellow patients that we think will be able to understand the information we're giving to a particular patient if the patient does not. So it's not all about you're just reading out in English language, giving all these big words, and this is what this is what you should expect. This is what by the time you see the expression, and that is where the communication comes. There's, there is oral, there is the facial, non-oral, and so the facial look and the actions of your patients, even the way they know, you'll be able to know whether this person is even for ask. Do you have somebody that went to the hospital with you? If the person didn't come with anyone, if there's a way you can find out where the person is from, look for somebody that can help to get the information across. To avoid a situation where you have some patients, they're placed on insulin and they are injecting the insulin, but they're not even opening the cartridge itself, not to talk the pen, not to talk of injecting. So anything that will make the patient to comprehend or your client to comprehend whatever you're telling them, if you can go the extra mile, that will be a very plus, that will be a plus for whatever you as a pharmacist you are doing. And lifestyle modification, yes, you encourage changes such as diet adjustment, smoking cessation, and exercise, no matter how small exercise will be, even if it's just to pace up and down the room, do exercise within their compound and everything. Just tell them that they just have to keep moving. Just keep moving, especially for the patients with non-communicable disease. They have to keep reiterating these things to them and let them know that once they feel pains or they feel uncomfortable, they can stay it out and then after a while go back to it. Pharmacovigilance, which is the science and activities relating to detection, assessment, understanding, and prevention of side effects or all that medicine and vaccine related problem. It's something that pharmacists have to stay on top of. And like I said, the good thing now is even without having the forms, there are sites, there are NAFDAC sites where you can upload when such information is, and it will definitely get to the right quarters. But let us not overlook it. After confirming, looking at the, you can say that, oh, is this medication? Sometimes when we're not sure, we can still report. Just put that, okay, these are the medications we're looking at. Then the right authorities will look more into it. And if there has been similar one for another drug that is part of it, they'll be able to see it and send it out as signal. And because of that, when adverse drug reaction to, it's a very important one. Make sure our patients are aware of it. So for pharmacovigilance, the reporting system is key. Then the assessment, risk assessment and mitigation. Patient education on ADR is very important. So we have to educate patients on ADR. It's a continuous education on ADR instead of them to experience the ADR and they are linking it with some supernatural thing or that is one evil thing that is happening somewhere, or they feel that that the best thing is to just stop this medication and everything. But once they are already educated on it, they know it's something that they have to look out for. Like, for example, dark urine for some people on flagyl, or so it's once the patients are aware, it will go a long way. Pharmacogenomics, and that is we're talking about individualization of patients. It might not be so common in our climes now, but I can assure you that it's really coming, that there are a lot of studies that is going on with it, and very soon it's going to get to us here for this pharmacogenomics and continuous drug monitoring. Okay, my slide is frozen. Wow. Okay. So yeah, okay. So interprofessional collaboration. Wow, that's one thing I'm passionate about, because really, if you have been deeply involved in interprofessional collaboration and you have seen the results, you would know that that is the way to go. It's a very important tool when it comes to when it comes for pharmacists. We have to go out of our way to collaborate with all others, because the truth is, when you are able to contribute and you see a major safety concerns for a patient, then you know that this is sort of understanding. It is a case of understanding. And maybe from the beginning, I would always advise that roles and responsibilities can be mapped out, so that there won't be, you won't find a situation where, though there will still be situations like that, but it will be less, you won't find that happening more if roles and responsibilities are already spelled out from the beginning, where you have roles clashing. Something, when the other members of the L team knows that when you make your contributions, this is uh, you are able to help in, take for example, when you make a contribution that helps a patient that would have stayed like 2 weeks or 3 weeks in the ward to reduce to like 1 week. You understand? Or maybe to change a medication that has been a serious issue with patient, or maybe there are times when there's a particular medication is not available in the dosage form that is needed, and if the pharmacist was contacted and were able to like compound something that's able to compound that medication, and the patient is able to get that medication, and you see the patient, getting better, the outcome is so much to go in when it comes to medical safety and effectiveness of the treatment. I would say that pharmacists, let us go out of our way to collaborate. The other members of the healthcare team are not really willing to cooperate. It is what it is. You just have to do your part. And depending on how you communicate it, this would go a long way. And whatever you do, whatever intervention you do, document it. Even if you can't document it in the case note, document it into something that you have. So that when it comes up that has to be discussed, you can say, oh, there was a time I offered suggestion concerning this and this and this. And before you know it, you will see that people will be like, oh, okay, so this person has something to offer, and everybody wants to make their job easier. And all of us are just working around the patient, which is like the core of everything and of that all of us are doing. Pharmacogenomics, I've said it already, study of how genes affect the individual's response to drugs. This field, which is an emerging one, combines pharmacology and genetics so as to tailor medication therapy to individual genetic profiles to ensure safety and efficacy. In diabetes, for example, there are lots of new emerging medications that are targeted at the insulin site itself. You understand, such that when, because take for example type 1 diabetes, that they don't even produce at all. They don't even produce insulin at all, because the gland does not even produce insulin. But the truth is that, well, you can imagine a situation where, because of the genes that has been isolated for a particular patient, and they're now able to use it. Take, for example, stem cells. So people are even using stem cells, and it's such that that's the particular genes that is responsible for that particular disease state. The medication is tailored to that particular, and such that it goes there to that particular, to work at that particular site. So that is the whole idea. And this, of course, we call safety. This is being used already in management of even cancer. Now, for most of the drugs that are used in the past are such that they destroy the surrounding cells in the process. And that's why some of the cancer patients, they are like worst off at the after a while of taking their chemotherapy. But when you have a situation where drug is only targeted at the site, the particular site where there is that multiple and proliferation of cells, and destroys only that alone. So this has been used in a lot of situations. For example, the cytochrome P2D6 polymorphism as in part metabolism of opioids and antidepressants, requiring dose adjustments. So it's such that they've been able to do it. So for opioids, for example, because of all the side effects and adverse reactions that people have because opioids, using it for pains, has its own advantage, but there are some adverse effects that comes, which is what some of people that abuse drugs are using. But with this kind of situation, the patient to get this, so we can prepare ourselves so that when this comes around and we have it more in our clients, we should, as pharmacists, be out there to help to improve this. In drug selection and optimization for such cases, you find a situation where you have to guide the drug selection and dosing. An example is found in warfarin dosing, which is influenced by VKORC1 and cytochrome P2C9 genotypes. And this has helped a lot for patients that that needs to be on anticoagulants for a long time. I know warfarin, for example, for if a patient on it for a while, you can over time you can have that side effect of bleeding and all of the things. But when so-called side effects that you find there, and such another ADRs, like I said, and this it is found in a situation of abacaba used for HIV. This has helped to prevent hypersensitive reaction. So it's about safety. Pharmacogenomics is about safety of the patient, and at the same time helping the patient to get that the value for that medication without having such serious adverse effects that at the end of the day makes the patient to be worse off. So safety is the core of pharmacogenomics, and this help. I also have another case study here of a 72-year-old woman with history of heart failure, hypertension, and type 2 diabetes that was admitted to the hospital due to worsening shortness of breath and fluid retention. She was discharged with a prescription for multiple medications, including a loop diuretic, a beta blocker, AC inhibitor, metformin, and statin. When the patient came back 2 weeks after, we found out that the patient was readmitted due to had hypotension, dizziness, and AKI. AKI is acute kidney injury. Of course, as pharmacists, you are already looking at the medication that the patient is discharged with. Like for a patient to have developed the AKI, definitely the AC inhibitor, like I mentioned before, might have something to do with it, because there are some drugs that can cause it for a patient that has the tendency to have kidney disease, or should I say risk factors for kidney disease. So if the patient is placed on AKI, especially for blacks, that's why ACI inhibitor is only advised for, it's only recommended to be added to our medication if the patient has been found to have CKD. So for this patient now, you see that the patient had this inhibitor. So, and also on inquiry from the patient, in fact, that's why, you know, I mentioned it, that there should always be medication reconciliation and looking at everything that the patient is using. Let's take our time to find out about it, because we found out that the patient was even on NSAID. That's for a patient that's already developed AKI, even with the heart failure, hypertension, and type 2 diabetes. NSAID, for example, is known to cause what we call analgesia nephropathy. And a lot of our patients, especially the elderly ones, they are usually on this NSAID. That's non-steroidal anti-inflammatory disease and analgesics. They are on this NSAID. So we need, anytime they will be told, we need to constantly ask them about the medication they are using. And that is what is called, and that is why we say there's need for reconciliation of their medication anytime they come. So this ibuprofen now has worsened the AKI, has made the AKI to now to be very obvious, and that has that's led to the patient now having shortness of breath that is even now worsening. Then the fluid retention that the patient had, which were the loop, which necessitated the use of loop diuretic, now found out that the AKI now become more pronounced now. And of course, for this kind of patients, first to stop the NSAIDs, the ACI inhibitor to hold the ACI inhibitor will be a good option, and to try the patient on CCB if there is no if there is no contraindication for use of CCB. So for this patient, you can try this patient with CCB, pending when the AKI would because if it's the NSAID now that has caused that AKI, you want to change the NSAID to maybe celecoxib or to paracetamol. You know, I know some people would say that with paracetamol take care of the arthritis pain. Yes, another thing that can be done is to use for the patient to use the cream that's maybe like all these methyl salicylates and go, pending when you'll be able to come out of this AKI, and or change to another NSAID that will be used once in a while. So it's just to try and see how we can help the patient. But for the AKI, the patient would definitely have to stop the NSAID. So for medication therapy management intervention, I said medication reconciliation is very important. Patient and caregiver education, that's for also the community pharmacy, that is client and caregiver education. Once in a while, even in the community pharmacy, sometimes you find some people, they will just send maybe somebody that is staying with them to help them to get their medication. If you feel that this particular medication is a medication that patients will need counseling on, and you can request that, can I possibly see the person that needs this once in a while? Or if the person comes and the person does not understand what you're trying to say, can tell the person to come with and that. So it is in all situations that we'll be able to do this to help our patients. And then for collaboration with healthcare team, I have emphasized a lot on that, and how we can go about it. For the community setting, I know there are some community pharmacies that have collaborations with some physicians in hospitals around them. So this can definitely help a lot. When if there is need for referral, we can do that just to make sure that we get the best for our patients. So challenges in clinical integration, it's usually like workload and time constraint, training gaps and lack of clinical exposure is another one. And then there's always resistance to change by our colleagues sometimes, then policy and regulatory limitations. For workload and time constraint, sometimes we're burdened with volume of prescription to fill. And that's why a lot of studies have said that we should leave prescription filling. In terms of what we should do is to look at the prescription and do what we call prescription audits. After doing the prescription audit, the next thing is to allow the pharmacy technicians, people that were trained, to help in dispensing. That while we try to focus on the so that we can focus on the clinical aspects that we have to do. Then, of course, there is administrative task too, and inventory management. Most times, it is an administrative cadre that does that. So it's just that once in a while, when we are less free, we can also be on the table and see how we can help with what is going on the on the clinical floor, rounds and everything, because experience will always be there. You always have that experience that you need to impact at any point in time. But the whole idea is to see how we can reduce the workload. So pharmacists are expected to manage dispensing duties while simultaneously handling clinical responsibility. So in the low-income settings like her, low-income countries like her, there's limited training in clinical pharmacy during our undergraduate days studies. Yes, the good thing now is that we have now PharmD, and PharmD has embedded a lot of clinical pharmacy courses now. So I think this will definitely help for integration of clinical integration into clinical pharmacy integration into the pharmaceutical care that we practice. So then the shift towards clinical pharmacy is met with resistance from physician nurses. Yes. And because the truth is that some, especially settings that in the interdisciplinary ward rounds did not start early. So definitely by the time you want to, anything that is new, that would always be a form of resistance. But with time, when they know that there is something that this is going to offer, it's just to stoop to conquer to see how these things can be done. But the good thing is that in the community setting, this there is really much barrier when it comes to doing the clinical pharmacies thing. Then for policy and regulation limitation, you find the situation in which in some countries, regulatory framework will not support pharmacists' expanded clinical roles. And this will restrict ability to prescribe, adjust doses, or conduct comprehensive medication therapy reviews. Okay, so in our own setting, well, like I said, we're able to at least conduct comprehensive medication therapy reviews, adjust doses, even though we're still not able to document properly inside the things. No, but we can always do our own documentation. Some settings, pharmacists are even writing prescriptions after they have done their MT reviews. Yes, we're hoping we'll get there, but let us still document our own so that when the time comes and we want to push for these regulations, we have a lot of documentations to bring to the table for it. And this will help in our healthcare system. So for workload, you assign non-clinical responsibility to pharmacy technicians, implement electronic prescription systems, barcode, robotic dispensing machines, and for structured appointment systems, scheduling dedicated patient consultation hours within the pharmacy workflow will ensure that MTN are not overlooked. I look forward to a situation where MTM will be remunerated in this country one of these days. Let us just keep documenting what we have. I'm sure regulations will reach there one day. Then for continuing professional development, yeah, encouraging our pharmacists to participate in ongoing education like this and several workshops, postgraduate studies, diplomas, any opportunity we have would make sure that we're part of it and learn. Because the one thing about medicine is dynamic, and the medical world is very dynamic. A lot of things are always changing, so we have to stay abreast. For residency and fellowship, there are a lot of residency programs, hands-on, that is in hospital setting. We can always get involved in that. And for clinical pharmacy, I've already mentioned it now that there are a lot of clinical thing that is going on there now. within the pharmacy space, and that's when they have increased to pharmacy. They have increased to PharmD. But I would say something. I think I don't know. I'm sure there's discussions ongoing about that, where we have pharmacists in the clinical setting, community pharmacy and hospital pharmacy getting involved in the training of our pharmacists, of our pharmacy students, especially now that we have the medical, now that we are going into the PharmD. Okay, so, yeah. So we're back again. Okay. So advocacy and awareness educates healthcare professionals about the benefits of clinical pharmacy through seminars, collaborative case studies, and real-world success story. And for interprofessional education, we encourage joint training programs where you have the medical, the pharmacies, nursing, and all others learn together. I mean, I want to see a situation where you have such cases. When I was in school, I think we had courses like that that we all do together. This would help in having a culture of collaboration and mutual respect among ourselves. Everybody knows that nobody wants to take over another person's job. They're just doing your own. For advocacy, professional pharmacy organization like PSN, PCN, you know, ARPIN, and all others, and also policymakers generally should advocate for expanded clinical responsibilities. And for legislative reform, government should revise healthcare policies to formally recognize pharmacists as essential members of clinical teams' well-defined roles. We as pharmacists, our professional organizations would have to push for that. And like I said, we will need documents that would, our documentations that we have done about the interventions, about the roles we have played in the past will come handy for that, to be able to push for that in the right quarters. And that's why they say more of us should go into politics. So integration into national healthcare team, pharmacy-led activities, services such as MTM, immunization programs, should be incorporated into national health insurance schemes to ensure accessibility for the patients. And once such that patients know that they can always get all these things, which all these activities, all these programs in the community pharmacy setting. So in expanding the pharmacy scope of practice, there is need for prescriptive authority and collaborative drug therapy management, because this is very important in taking us from our traditional dispensing to clinical decision making, and getting involved in public health services. For getting involved in public health services, that's where the health promotions, the outreaches that we can have like 3, 4 community pharmacy joining together to have what we call like a mega outreach. These ways of letting them know that pharmacists were different, that the pharmacy layout is different from just the from patent care, patent medicine, outlets or anything. So we'll be involved in it, which is more of preventive activities. So, and that's, like I said, includes that promotion, to the health promotions, and I mean, that's where we're able to get some of these things. In the process, we're able to even refer some patients that we refer them to the hospital. Before, even the community knows that pharmacists have a lot to offer than just selling drugs, So this is something that we should do. And by the time, by God's will, we're able to get that prescriptive authority, that will go a long way. So like I said, integration into primary and specialized care team. You can have community pharmacy that are specialists in maybe diabetes medication, some specialists in maybe generally non-communicable disease. They already know that any non-communicable disease medications, they are there, and that they know how to advise and know the investigations that needs to be done and how to move it forward. And this will go a long way in us having our part of place in the public health and preventive care services. We cannot do without the AI, that's information technology. With AI now, we're able to do a lot of things. We can use it for automated drug-drug interaction detection. We can use it for personalized drug therapy, even for some of our patients as time goes on. And they have chat box and virtual assistant that we can quickly use to get information that we can use for our patients. So if we have an AI application on our system, we can quickly type some things there, and then it brings out a lot of information about some medications. If there are some updated information, you'll be able to give us. That way, we're always abreast of information that has to do, and this will help to improve medication safety, optimize drug therapy, and support us in decision making. Yes, that takes us to future perspectives in pharmaceutical care. I would say the landscape of pharmaceutical care is evolving rapidly, and is driven by advancements in technology, expanding clinical roles for pharmacists, and increasing support from policy and regulatory bodies will go a long way. So we need to ask for this support from our policy makers and regulatory bodies. In conclusion, optimizing patient care through integration of clinical practice into daily pharmaceutical care is essential for improving medication safety, treatment outcomes, and overall healthcare efficiency. And the evolving role of pharmacists, from traditional dispensers to active clinical practitioners, highlights these critical contributions to patient-centered care. And through MTM, pharmacovigilance, interprofessional collaboration, which will be gone, and patient education, very important. You need to educate patients about their disease, and they feel like they are part of it. They are part of their management. This goes, it excites patients. Over time, I found out about that. They are excited when you educate them so much that they know so much. I've found it, I've had patients in the past that would call me and tell me, I think I'm having hypo. You know, though sometimes they take it a bit far, but that is just to tell you that when they know that they know so much about what is going on with them, it helps them and it makes them to open up to you more. And the empathy that pharmacists are known for, we'll be able to bring it to bear and be able to get more information from our patient that will help us in deciding and making decisions that will help our patients to get better. So that way we play a pivotal role in optimizing drug therapy, preventing ADRs, and ensuring medication adherence. Thank you, and God bless. Any questions? Thank you very much for having me.
Wow, that was just amazing. Thank you so much, Famulupe. I mean, this is a very amazing start to our webinar this year. I am very excited at everything that we have learned. I'm sure that I'm not the only one who feels this way. So we'll be taking questions now. I'm sure that a lot of us have questions that we'd like to ask because a lot has been said. And you know, the truth is, I like the reality. Like I like how this went, facing the reality of the situation of, you know, integrating clinical practice in our current healthcare system, the structure and all of that. And I know that we have questions about how we can further integrate, how we can collaborate with other healthcare providers, how we can better communicate with them. I'm thinking of even doing a follow-up session on, you know, interpersonal or inter-collaboration communication, like some skills that are just necessary in this present time for us to have. So if we have any questions, we can, there is a comment in the, all right, so there is a comment that I am saying, and it's a contribution. Yes. Yeah, okay, it was a contribution to the case study that was shared. So thank you very much. So I would just say that for us as healthcare providers, especially community pharmacists, I think my question has always been how to, it's different when it's a hospital setting and we are directly interfacing with the doctor. So we kind of understand if they're in the office, how to, when they're on sick, like what clinic, what doctor is having this clinic and all of that. But sometimes when the patients come to the community pharmacy, right, there's usually no form of follow up with the doctors. So if, for example, I'm a community pharmacist, and as a community pharmacist or as someone who has worked in the community pharmacy setting before, I understand this challenge can be a bit frustrating when you know that okay, this prescription should really be looked into again, and you have no way to reach the doctor or the prescriber now. So how can we I mean, I think at this point, anybody can give their contribution in the Q&A section because if we have community pharmacists on the call who have been able to hack this, I would really like to hear. But Famudupe, can you help us or do you have any idea as to how we can maneuver or work our way around this situation where we have something that we have observed or noticed and we need to communicate this to the doctor, but we are not able to because of the communication gap. So can you help us with that, please, ma'am?
Okay. Are you referring to how to refer to doctors or to ask ask about a particular prescription? Is that
Okay,
what you're
yes.
talking about? That when a
Yeah, so
patient brings a
referrals, in fact, I
prescription,
think referrals are something else that will even come up. Maybe someone can ask that. But right now, I'm talking about how to, communicate with the doctor. Like there's a prescription already in front
when
of you, and you need to address it with the prescriber. Yes, that's what I'm referring to.
well, I agree with you that it can be a very challenging one, actually, because most of the hospital setting, especially the public setting, even when the patient wants to collect their numbers, they're always like, "Why would you need my number?" So I know what you're trying to say, but I know there are some community pharmacies that have been able to come through us. Okay, if I must say, if I must mention a particular one, for example, pharmacists, Victory drugs. She has had to call me several times about prescription. If she has a prescription with her that is written, that she knows that is from lawsuit, she will usually call me and then ask that this is the name of the doctor that I'm seeing there. If it's a doctor that I know, sometimes I help her to get through to the doctor, or most times it's usually maybe some people cannot read a particular prescription. Because we see this much in the hospital, we're able to help her. But sometimes when she asks about this, if it's a doctor that I know, I try to get into it. But yes, it can be very tricky because we have quite a lot of patients. I think that is why sometimes we will need to now stay with the patients, take our time with the patients, go through medication history with the patients, and medication and medical history of the patient. That can also help us if we cannot get back to the prescriber. So that way, there are some medications that are written for the patient that we are looking at it like, why would they write this for this patient? But sometimes when we take our time to find out about some medication history and medical history of the patient, or something that the patient is currently going on through that the patient maybe didn't tell you about that moment, you can just say, can you recall everything? You can ask, can you recall everything you discussed with the doctor while you were there? So you might have said something that made that particular prescription to be written. So aside that, if there's some that there is no explanation for why this should be done, we should just do our we'll just do our regular intervention and make sure that we give the patient what we feel will work at that point in time. And you can always ask the patient to check back with us if there is anything contrary to what is expected. So, and if that should happen, then you can now ask the patient to go back to see the doctor and then say that this is what I have noticed about that. I think that that's it's something that we can do if we cannot get across to the doctor. Thank you.
All right, thank you very much, Famulupe. Yes, I think I totally agree with you when you say that we should always also quiz the patient, right? When we see certain prescriptions, quiz the patients like in detail, like what exactly to just understand the interaction between them and the prescriber. And I think I also heard you talk about, you know, an interaction with a pharmacy. And so this just made me realize that even as pharmacists, there shouldn't be silos even between community pharmacists and hospital pharmacists, because if there was that seamless integration between pharmacists in the community and pharmacists in the hospital, we would even know which pharmacist is present in this particular hospital. So if a prescription from, I don't know, maybe military hospital comes in, and then we know that, oh, I know this pharmacist XYZ that works in military hospital. Let me reach out to them. So there are a lot of ways that we can even break down barriers, even within the pharmacy space, that will help us to be able to penetrate into the hospital. So thank you very much, Famodupe. So, I mean, before I go into the other question that I have seen,
Welcome.
I was talking about how insightful the session is. I mean, all of the things that you talked about, first of all, even the components of clinical services and how all of this contributes to improving quality of life and reducing hospital stays. We say that a healthy nation is a wealthy nation, and that's not true. I mean, in my time at Unilag, when I was doing my public health degree, so it's like there was a lot of talk about how the health of a nation, and it's like there are studies regarding it, is tied to how wealthy that nation can be, because the length of hospital stays is eaten into the time that the individual could have done a lot of more profitable things. So if we are looking at it in that sphere, like not just with the individual clients now, but we are looking at it in a broader perspective, we understand that collaboration is really not something that we should still be talking about, but we should be looking for how these collaborations can even impact the lives of the patients that we're dealing with. So thank you very much for mentioning that. And then when you talked about interprofessional education, the truth is, the reason that I know that, I think that there is still a lot of restriction from other healthcare providers is because they aren't receiving the extent of knowledge and insight that we are, right? So we are learning it, but what exactly are the doctors learning? What are the nurses learning? Are they aware of all of the roles that pharmacists can play, all of the ways that pharmacists can make their lives easier? So that is really something that should come up like across board. This is just me putting it out there. So I'm thinking that even at drugstore, that's something we should also talk about. That's one of the things that would probably come up in our subsequent webinars, like an integration of all of the healthcare providers in one place, and really just talking about the function of each one in the broader sphere of medical care or healthcare. So thank you very much, Famudupe. So there are questions. One question is, so thank you very much, Taz, for adding more, for contributing to the risk of acute kidney injuries, talking about the simultaneous use of diuretics, renin-angiotensin, aldosterone system inhibitors, and NSAIDs. Yes, that is so true. And yeah, it needs to be investigated. Like, more research has to be done in all of these things. Yeah. And then another question is, how can pharmacists integrate proper pharmacy practices to enhance collaboration within the healthcare delivery system, ensuring improved patient outcomes and seamless interprofessional communication? So in a nutshell, how can pharmacists integrate, what practices can pharmacists do to enhance collaboration and improve patient outcomes? What are those activities that they can do? Famodipe, I don't know if you're also seeing the questions, but do you understand what I just...
Yes, I saw the questions. I think I discussed that extensively. That's most important. Collaboration would be, you'll be looking at communication. That's something that a pharmacist will be able to do always. You should be willing to do that, to make sure that you have like seamless communication with whatever you're having. Then also in having increasing knowledge. That's placing your making sure that you improve your knowledge such that you have something to offer in that interdisciplinary space. You have to make sure that current you are abreast of current information. You can take, for example, a situation where, um, let's say, a pharmacist is part of a team now, and the pharmacist is talking about a drug that's a medication that came out like 2 years ago, and the physician is talking about a medication that was just released 2 weeks ago. You can imagine how that would be, and then maybe the physician is saying that, no, 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 I think this will even be better. And you're like, what is that one? I don't know that one. That kind of, you understand what I'm trying to say? So
Yes.
that's why for you to be in that space, for you to do on that communication, for you to improve on that collaboration, you yourself you would have placed yourself in a way that you have something that you have a lot to do. And then the practice ourselves, for us in the community, we should have a practice that is top notch. That's why I said some of us can go into some specialist medication, and everyone knows that when it comes to a particular medication that has to do with some set of diseases, meet this particular, go to this particular current pharmacy. Not only will you get the medication there, but they would also advise and counsel you on it and move you up with it. So all these things would improve for collaboration. And like I always say, nobody wants to know what you know. I keep repeating it until you let them know what you know. And letting people know what you know is not about you just bragging that I'm a pharmacist. And you need to listen to me. No. If you are talking about collaboration, you need to show that these informations, you have it. And these informations, when it is used, it will help, just like the question the person has asked, to improve the patient's outcomes. By the time you improve patient outcomes such that the hospital stay reduces, the quality of life of the patient is improved, and the management generally of the medications is improved, about even cost effectiveness. By the time you put in all these things, you as a pharmacist, you are able to contribute on the line of all this. There's no way the collaboration will not be extended, and it communicates all these things in a proper way, that shows that, yes, these people are my colleagues. But when you say collaboration is not fostering. You are collaborating somebody. All of you are looking at these things together. So you need to have your practice where it is in the right institution and the right place, and you're doing the right thing for you to be able to collaborate better.
Thank you very much, Pharmaceutical. So yes, so honestly, communication it cannot be overemphasized. Knowing the right words. I know that it's not exactly like you are, walking like you are stepping on hot coals. It's just more like and acknowledging the other person and respecting their position, respecting their opinion, and offering your own as well. So when you are coming from a place of respect, it will be reciprocated. I think that pharmacists can also do this by having a documentation also. There's something that we learn in pharmacy school. If it's not documented, it's not done. It is
At all.
it is very important to
At
document.
all.
Whether you are in the hospital space or in the community pharmacy space, documentation not is not even something that we can talk any less about. And understanding the place of patient education. So, like Famodupe mentioned, patient education is like there are some things that a
Very
pharmacist
important.
will tell the patient, and then they'll be like, no, the doctor didn't mention it to me. That is why most patients people prefer to sometimes go to the community pharmacy because of that time, that relationship. And it's because of all these things that they hear. So when they hear and absorb all of these things, even in the perception of pharmacists, even with the patients, is, if in fact I know that pharmacies have got to that point now where people are even having their own family pharmacies that they consult for medication related things. So at that
Exactly.
point, when patients even see that, oh, when I go to this pharmacist or pharmacy, I gain more insights, I learn a lot more. It's always a game changer for anything. And then for documentation, you can do
Yes.
that with, like she mentioned, with technology. I know we know as drug software are very, tech savvy, tech enabled, and we always push for the world is going where the world is going is where we want our healthcare providers to go, and that's, with the development of AI, we have tools that even that have all of these things that Fan has said. Kilometer, for example, can help you to take a documentation of everything of all your clients, like clients that come, you can document their blood pressure, like for non-communicable diseases, it's always very, very important to have this so that when the patient comes the next time, they know that you have their history. Speaking from a place of knowledge is it beats anything else. So I hope we have answered your question, Family Lamdi, and I hope that it was well answered. So thank you very much, Taz, for contributing that patients should be encouraged to do medication review every 6 months by their pharmacists, and they should be given lists of medications they are using with what the medication is used for. So yeah, so if like what I said about NCDs, you have a chronic care patient and you need to one, and they don't even know what they are using. So many times patients don't even know the medication they are using. They just come with packs to the community pharmacy and then they say, give me this, give me this. But the pharmacist that goes the extra mile to really properly educate them that this is what you're using, this is what it does for you. Maybe right, like Taz said, use it, do a list, or just keep reiterating to the patients. That goes a long way. Like Famudippa said, we should always go the extra mile. Thank you very much, Taz, for that contribution. So can Drugstock have more locations at least in each local government area to ease distribution of their medicinal products? Oh, amazing. I mean, I'm happy that we are seeking more from Drugstock. We have reps that are in that have covered all of the districts in Lagos. So our reps are everywhere. They're they've quite penetrated like local governments, I believe, but this will definitely be taken into consideration. If we are getting this kind of feedback, it means that the pharmacists have seen something or have come across some certain challenges. So I'm definitely going to note this down to take back to the team. So yeah, but in the meantime, we have our reps, we have our app. In fact, so I don't know if you have the drug stock app. When you download the drug stock app, you can easily order for medications right from your pharmacy. Like you don't even need to walk anywhere. You just order it, you just download the app, get verified, and you're able to place an order straight. It's very simple to use. So you can reach out to our customer service if you want more information on that. Please, can the customer service number be shared with the participants? Peter, thank you. So there's another question. What are the roles of MDT in optimizing pharmaceutical care? Also, Famotipek, can you shed more light on the need of pharmacovigilance in optimizing pharmaceutical care in the present time? Yes, I like that pharmacovigilance question. And then a third one, in what way can artificial intelligence modulate the optimization of pharmaceutical care in the current healthcare delivery system? Thank you very much, Pamini. These are very, very good questions. So, Famudupe, can you see the questions, please?
Yes, let me go back there.
Okay, so the first one is, what are the roles of MDT in optimizing pharmaceutical care?
Okay, so I think MDT, I want to believe, is multidisciplinary team that he's talking about. Okay, so if it's multidisciplinary team, mentioned it that when multidisciplinary team on rounds, that is when that is the best way to optimize pharmaceutical care actually, because the team comprises of not only the physicians, the pharmacists, you also have the nurses. Let me give you an example. There was a case of, I think, was he, there was a patient that we had then, that were having issues with mixing, how they were going to get the medical. I think the patients along the line um, could not tolerate oral. So while we were around, when normally the physicians, or it might be the senior reg, might be junior reg, anybody, will first of all go through the case notes, would read out the things that has been done, the recent one, and then you find everybody now contributing. So it was now like I remember the nurse was saying, we could not give big because when we tried to give the patient, it was the patient was not tolerating it and all. So the pharmacist came in to say, okay, so we can provide you with a small mortar and pestle, that you can use to compound, not compound now, maybe to dissolve that particular medication for the patient to be able to use it. So we came up with the idea, and when we did that, we even did the first set for the patients, that particular time to be able to use it. Because, by the time they were going through the charts, we just found out that it was just not given, like 3 days. And we're like, why? Why was this medications not given? When the nurse that was with the round, that was in the medication, that was in the multidisciplinary team, now say, this is what happened. When we intervened at that moment, the pharmacist, by the second day, we were already seeing improvement, because we were not seeing any improvement. And as the pharmacist that was part of it, I just picked up the drug medication. At first, nobody said anything about it. It was just like, so should we just change drug? I said, wait, before we change this drug, this medication, let's check about the adherence, let's check about the usage. And when we found out that by the time the patient used like 2 times using that particular method, which we followed up, and we were always going to the ward to do it, we started seeing improvements. So that is one way we've seen of a multidisciplinary team being around. You can imagine the chances are that if we didn't have like a pharmacist on that team, we wouldn't have been able to do it. Or maybe it was just the doctors, and even if the nurses were not even around to say that, okay, this is what has been happening, and because of that, we have decided to hold the medication. So you find such things happening, and that is the essence of multidisciplinary team, where everybody comes and brings something. Sometimes even social worker is there. The social worker is able to contribute. Okay, maybe because of the environment that the patient is living and everything. I mean, I saw all these things when I was in Chicago during my training, and bringing it back, you realize that everybody has a particular role to play in such a thing, as long as the role you are playing as a pharmacist, the role that everybody else can gain from it. There was another case of a patient that was having acidosis, metabolic acidosis, and because not get the sodium bicarbonate tablets, then it was scarce. We had to contribute that. Okay, let's see if you can get the powder. We would plan it for the patient and do it for the patient. Several situations like that. Sometimes it is the insulin, maybe it's the storage. Sometimes it is the fact that some particular medication was being used, and because of interactions that we have noticed. So multidisciplinary team goes a long way in improving the nutrition treatment plan for the patients. Everybody has to be there to contribute their own quota in it. The second question, what was the second question? Something on pharmacovigilance, right? I think something on pharmacovigilance. Can you hear me?
Yes, 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 yes.
Okay,
So can you shed more light
pharmacovigilance. Yes,
on
I
the
think
need
I
for
talked a lot about
pharmacovigilance? Yeah.
yes. Okay, so the pharmacovigilance, I did talk a lot about it. Pharmacovigilance is key. In most settings, pharmacists are the ones that are always pushing. They are the forefront of pharmacovigilance. And that is understandable because we're talking about medications. That is our core, so to say. That's the core of pharmacies. That's what we're all about. So we should be seen to be making sure that there is safety, that medication safety should be paramount in whatever we're doing. as pharmacists. And that is why every time, well, in some setting, I remember there was time we were doing lectures back to back for all the different members of the healthcare team in our institution, where you have sometimes will be the doctors, sometimes the pharmacists, even the physiotherapists, even the laboratory scientists, because they are some of these chemicals that they are using that the safety can be that can be can be questionable. So you keep telling them that once they see any sign of anything that seems not to be working, they have to bring it up. And that's when you talk about pharmacovigilance, when you talk about reporting it, the pharmacists, there was a time that some of the medics were like, that's too much for us before we see several patients and now be documenting. And said, no problem, just call or ask somebody to go to the pharmacy or ask the person to come. We will document on your behalf. You understand? So that's just to show you that pharmacovigilance is very important, and getting a signal across would help for the others that will use that particular medication to know that, yes, this is what is going on with this medicine. And of course, you'll be able to get it across to the patient. And another thing about pharmacovigilance, because of the fact that monitoring it helps to do about it, it also helps adherence at the long run. Because if there is this adverse effect that you have not already discussed with your patient, or the patient has it and doesn't even know about it, you can make the patient not to adhere to the medication. And when it's not used, it will not that particular effects that it's supposed to have in the patient. So all these things shows that pharmacovigilance is very key. Documenting it is very important because medication safety is very important. The safety of the patient, safety of the drugs, and the outcome that comes with it. Thank you.
Okay, thank you very much, Famodupe. We have really overshot the time, but it's been such an engaging session, so I understand. We have more questions. Family also wants to know in what ways can AI modulate the optimization of pharmaceutical care in the current healthcare delivery system?
Well, I've said this before. AI, like I mentioned before, is such that it's almost like can do almost everything. AI is designed such that anything that you want to know would always say, you can even bring it out for you like a picture. So you can even use AI to design, should I say, counseling. You can use AI to design counseling, maybe images, that you can put in the counseling room. So that can be one. And then also to get updated information about medications, that is there too. Several things. AI, that's just the way to go. There are a lot of things that AI is being used for now. It's just anything. Just imagine it and leave it to AI and see what AI can come up with as far as they are concerned. And because let's say the trend where we find ourselves now when it comes to pharmacy and other diseases is that everything has to be done properly. And if things have to be done properly, then you want to make sure that you're doing things in a way that would make it makes things easier. Let me just put it that way. AI makes things easier. Things that you would normally have done over a long time, you can quickly do it within a short time. And it helps with counseling, it helps with education, educating the patients, educating even the other healthcare teams concerning medications. And the digital system that we talked about, like using it to get information about the patient so that you can use it to decide how the patient should get their the best from their medication.
Okay.
So there is a lot.
Thank you very much. Yeah, thank you very much, Famodupe. The talk about AI is very interesting because, like working in a tech space, I interface a lot with tech team, and I know all the things that it can do, even as in the generation that we are in. Artificial intelligence for pharmacists, I spoke about the pharmacy management system, Kilometer. So the AI components of it can help pharmacists to, to give personalized recommendations. So if, for example, you have your client's names, the history of your clients on the device or on the system, and then very interesting, and you are recommending a particular medication that you have, because you have the patient's history, you have the allergies, you have contraindications. So if you, for example, type in like you are trying to prescribe or recommend a medication, because there is an AI component in it, it flags it that this medication that you are giving is contraindicated in this person, or this person reacts to it, or is this person is allergic to it. So that's just one way. Another way is the aspects of setting, for those that are in telemedicine. Even artificial intelligence can help you to set appointments. So some of those mundane tasks that we struggle to do because of time, artificial intelligence can step in, and then all of those tasks that, or those roles that as human beings we cannot have all of the information at the tip of our fingers, like drug interactions. If a patient brings in a prescription, for example, and you're trying to record that in your sales, pedometer, the AI components of pedometer flags it, like these two drugs or these medications in this prescription are contraindicated. Do you want to seek more information? So these are, or that they react, that there is an interaction going on there. So these are some ways that artificial intelligence is really helping with pharmaceutical care. And I'm sure that there are lots of things that we don't even know about that are yet to be revealed, and we are in for it. Yeah, so there's that. And then the final question, please, because we are like pretty past the time. Can retail pharmacies have more diagnostic tools and devices to help in treatment interventions, especially those that require blood samples? So this is like a rapid diagnostic test, I believe, that this person is talking about.
Yes, they can. They can, and I'm sure a lot of them are already having that. They can, a lot of them already have that. Is just to make sure that whatever tools you have, to know how to do the interpretation, and then know how to use the information that gets from it, to use it, you use it to improve the management of the patient. Because that's the whole idea, to be able to get all the what we call basic information about the patient. And these information are the ones that will be stored into the system for the patient. And anytime the patient comes, can be used to check back. Though there are some that are more extensive, maybe like the echocardiography, and maybe some that are really, that can really be very messy, that you need a laboratory scientist for. Yes, but the regular point of care machines, yes, is very important, because it's going to help the pharmacist at the long run to make informed decisions that would impact on the overall health of the patient. Yes, why
Yeah,
not?
thank you very much, yeah, so we have pharmacists that do blood sugar tests. I mean, that is even a part of community care that is becoming
Mhm,
very, very necessary. So the final
mhm.
comment is that, so the challenge in contemporary pharmacy practice is the advent of clinical practice. So I would suggest a residency program mandatory for every practicing and registered pharmacist, which should be conducted to enable our practice in Nigeria stay abreast with international standards. And upon defense, case studies on clinical conditions can be presented, and it will help the pharmacy profession a great deal. Like I said, documentation, like when we do these interventions and this like you shared case studies now that you have to fall back, that you can fall back on. So when we have more things like this, we are really on our way to highlighting clinical practice more than ever. Thank you very much, Famutpe. This has been such an
You're welcome.
insightful and engaging session. I mean, what a way to kick off our Drug Talking webinar for the year. I am so excited about this. This has been worth every time, every bit of the time, and I'm sure that our participants feel the same way too. And we have learned a lot. And at the beginning of the session, I mentioned that we have something coming up. We are going to, the next series of webinar will be about healthcare business. This will be a series of healthcare business masterclass. We know that it's really important to understand how to build and scale a successful healthcare business, both running, being the head of pharmacy in a hospital, or running your own community pharmacy, or working in a primary healthcare setting. These things are necessary. The administrative part of it, the leadership and development, there are a lot of things go into building a successful practice. So it's going to be like the next series of webinars that we will have. And it's amazing to see what's all the things that we can learn. So I want to once again thank all our attendees and thank Famudupe again for your time. We appreciate it. Thank you for sharing with us from your absolutely massive wealth of knowledge. It's been a fun ride today.